Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, which is now Integrative Movement Institute. Welcome, happy Wednesday. Hope your week is going well and you're out there empowering your community. In this series, we've been discussing, I should say in part one, we've been discussing the core and training your clients' core, especially in your older clients with low back pain. Now, why is this information so important, and why should you tune into it and pay particular attention to the concepts that we're sharing with you? It's because, first, there's a lot of misinformation out there and myths around training the core. There's lots of information out there, not all of it so great. So our goal, when Janice and I started Integrative Movement Institute, fitness education seminars so many years ago, our goal is to help you differentiate yourself from the rest of the noise of the fitness community, because there's lots of noise, there's lots of people doing things that are directly contributing to why their clients and why so much of our population is having problems. So what our goal is to provide you with information and evidence-based information so that you have not only the science behind why we teach what we teach and why this approach is so different, also application. Because it's great to know the science, it's great to know the evidence, but if you can't apply it, then it's like, okay, this is not really helpful. And I got a compliment from one of my buddies yesterday, and he's like, I hadn't seen him in a bunch of years. So my buddy Brian was a trainer in a gym where there's probably 100 personal trainers. And, very few of us sort of, there's all these people out there doing their thing. And, me and my buddy Steven, you've heard me talk about Steven, you've probably seen him in my books. He's a model for a lot of my books. He'll be the model also in my new book, Corrective Exercise Solutions Part 2, or edition number 2, the second edition. And Brian was another one of those guys that was in the gym, and, I respected how he worked with his clients. He's like, one of the things that, I really liked about your information and how you presented information was you made complex information simple. And I think that's what really differentiates our approach is not only do we know the science, we know how to apply the science, we know how to teach it in a simple manner. Now, simple is not always common, right? Simple is not always common. Because we know a simple way to lose weight is what? Eat healthy foods, get some activity, get enough rest, and you're likely going to lose weight. But we have to make it complicated because people don't like simple. And they get bored with simple. And you can't stand out from all the noise with simple, right? But it works, right? So it's the same thing here. So let's talk about core training just for a moment and why functional anatomy becomes so important and how to make this a very simple concept for your clients. Now, last time we discussed training the superficial element of your core. Now, obviously, it's not 100% superficial. You're also training the deep core muscles as well. However, we talked about pushing, pulling patterns, your rotation patterns, that all train the superficial element of the core. Obviously, yes, it's training the deep core as well. However, you're not guaranteed you're training the deep core at the same level that you're training the superficial core just because you're doing all these dynamic three-dimensional type movements. And for a lot of your clients with chronic low back pain, especially your older clients, just doing this kind of training is actually going to make them worse because they're using the strategy, they're strengthening the strategy that's already causing them their issues. So then let's turn our attention to the deep core. These are the muscles that are deep inside your body, attaching directly to the bones and the joints, right to the joints. These are the muscles that are closest to your spine and where spinal motion happens. There, your diaphragm, which attaches from the front side of your ribcage all the way around to the back side of your ribcage. It fascially blends into your psoas, your transversus abdominis, into your deep low back muscles, including the QL. The psoas, another one of those muscles, comes from your spine, the front side of your spine, from T11, T12, L1, 2, 3, 4, 5, all the way down into your pelvic floor, into the pelvis, attaches directly to the pelvis, into your hip joint itself, or into the femur, I should say. It's myofascially attaching your diaphragm to the pelvic floor. So again, It's a very important muscle, and when people are just randomly stretching this muscle out because it's tight or they've been taught that it's tight, are you really helping? Are they really helping people's low back pain because somebody feels better because they stretch their psoas out for a couple minutes? Is it really helping them, or is it actually leading them to more low back issues? Transverse abdominis, we know about that muscle and how it envelops the entire lower abdomen. It basically connects the lower rib cage to the pelvis. It fascially blends into that thoracolumbar fascia, a deep, hard fascia, not hard fascia, the deep, broad fascia, that thick fascia that connects your lats, your glutes, your deep muscles, that all those deep muscles also attach into. And then all your little muscles, the multifidi, not so little, but the multifidi, the rotatories, the intertransversi, the interspinalis, all these deep little muscles that are attaching directly to the spine. Now, you're like, so what, Dr. Osar? That's fine. So what? I don't know that information. I don't need to know it. But you need to know that these muscles act very differently than these muscles. And these muscles, their job is to not only provide segmental stability or segment on top of segment motion and provide that fine motor control. Because this is what we're talking about, motor control, how your brain is finding and using these muscles. It can find and use these muscles very easily because it has to do things. You need to do things. Your clients need to do things. So whether you're in pain or not, it'll find these muscles and use these. But the research is showing over and over and over again. This is why you need to understand research and understand the research you're looking at. Is if you look at research from Dr. Paul Hodges, for example, he was one of the first people, not the first people, but one of the first individuals that brought to light that individuals with low back pain had delayed activation of transverse abdominis compared to the superficial muscles. These muscles should contract first, and in people with chronic low back pain, these muscles do not contract first. And the research is very conclusive around that. When you look at the deep neck flexors, the rotator cuff of the shoulder, the hip muscles, the pelvic floor, the transverse, the diaphragm, the multifidi, the research has shown that these muscles do not contract first. Why is that so important? Because these muscles have to stabilize the spine or the joints they attach to prior to the contraction of these muscles. Otherwise, you're going to have altered loading going through those joints. Hence the reason why so many of your clients may have and perpetuate low back issues. The research also shows that if you activate these muscles, you can actually change your client's low back pain. You can change their motor control. It provides more optimal stability. And it's not to say that all you need is these muscles, or these are the most important muscles. The important concept here is to create and restore more optimal balance between these. Now here's the problem. What's the best way to activate these muscles right here? The best way to activate the deep muscles is, number one, you got to slow clients down. Number two, you got to get your clients to pay attention because your clients are distracted, just like many of us are distracted. Number three, it's not sexy doing the things that activates these muscles because you have to be quiet, you have to slow down, you have to pay attention, you have to be specific and not just move in the way your body's used to, those habitual patterns that cause the problems in the first place. So people will go to their Instagram or Facebook or YouTube or all the other social medias and then see people training this system and they're like, oh, I want to do that. And if you look at people like put all the information out there doing this dynamic athletic training, hundreds of thousands of followers because it's sexy, it's exciting. Oh, I want to train like an athlete. That's great. Just had a professional athlete. He's actually an amateur athlete. He's trying out for the Olympics. So you think about somebody trying out for the Olympics, the U.S. Olympic sprinting team. He's got the best coaches, best trainers, knows all the best information. Why is he contacting me? Why is he contacting me? I'm not the best trainer for athletes, so why is he reaching out to all the people he could be reaching out to? Why is he reaching out to me? Well, he's like, hey, I read your book, been following you a little bit, and what you say makes sense. I've been training this system a whole lot. This dude is jacked. You know, we're doing a virtual consultation. He's over in Germany or Austria doing some trial runs and trying to qualify. Dude's jacked. Even virtually, I'm like, ugh, like chiseled abs, massive chest, massive shoulders, massive glutes and thighs, man. Like, I'm like, dude, I want to look like you. But when he's showing me his movement patterns that I'm taking him through, I'll show you one example of that right now in a moment here. Like he's showing many of the same suboptimal strategies we see in our clients in our office. So how is a professional athlete, one of the 1% of 1% of athletes, why is he showing and demonstrating the exact same things we see in our 80-year-old clients? Like, because the same people that are training him, his coaches, again, they're obviously awesome coaches because they're working at an Olympic level, but why are they overlooking these fundamental issues with these athletes? And I'll say that some of these coaches are lucky they work with athletes because their stuff works because they work with athletes. It doesn't work on the everyday people. And that's why we see so many people in our society still having low back pain, still having hip pain, despite rehab and training, all this training, this crazy training that they're doing, this core strengthening they're doing, because they don't understand this concept and they haven't spent the time training their client appropriately. So let me show you one of the assessments I did with this athlete. So let me put you down here in my studio here. So let me show you one of the assessments to see how your deep core is working. Now remember that your deep core should be activating to stabilize your spine. So one of the easiest assessments you can do, there's lots of assessments. You look at breathing, you look at alignment, you look at squatting, forward bending. Those are just a few of the assessments. You do some muscle testing. But one of the assessments we do with all our clients, and this really helps demonstrate how effective the core is working and or not, is have your client bring one leg up to 90-90 or even a little bit more. Bring the second leg up to 90-90. Can you get both legs up? Can you continue to breathe three-dimensionally? And can you not distend? Because if you watch your client without cueing them, so don't cue them, have them bring one leg up, and then you can even have them put their fingers here so they can feel it, so you can do this virtually and or in person. And this is what you're going to see most of the time. This is what I saw with these elite athletes. Second leg comes up, boom, distension of the abdomen. Why are you distending the abdomen? Because you're using a faulty stabilization strategy. You've worked so much on the superficial core, you've taught yourself how to bear down to create core stability. Your abdomen should not be distending when you're loading your trunk and spine. It doesn't mean it can't do it that way, it just means it shouldn't be doing it that way. When you bring one leg up, yes, the core activates. The second leg comes up, core should activate. You should brace, but you shouldn't see this huge distension. You shouldn't see change where your back goes into an arch position like this, or the client's doing this to try to keep your back down on the floor. You should be able to maintain neutral spine. One leg comes up, second leg comes up, no change in alignment, no change in the position, and they should still be able to have a communication with you, still be able to talk to you and relatively breathe. Even though their core is activated, the breathing is a little more shallow because now their core is activated. You should not see massive changes in their alignment. So super easy assessment to work on. So, back to conclude our discussion. Hey Adriana, how are you? Good to see you today. Thanks for all of you guys that are on. So back to our discussion here. So the deep core, number one, should contract first. They should contract to help stabilize and send back proprioceptive signals to the central nervous system about where the body is, about loading, and about the control around the area. The superficial muscles help to maintain a higher level of stability, higher level of movement, and control of movement. They have to work together. These muscles have to be coordinated with three-dimensional breathing. That's why the diaphragm is part of this group, or I should say, is part of this group, and it contributes by aligning, controlling, and providing the internal control, the internal pressure regulation that we ultimately need for our clients. I showed you a very simple, easy assessment to see how your client's core is functioning, and do this with your clients. Do this on yourself. If you feel your belly distending when you're doing this assessment, your strategy is suboptimal. You may be strong, you may be stable, you may have no low back pain. It's still a suboptimal strategy that could potentially lead to why you're not performing at the levels you need to and or want to, and why you may develop chronic tightness and or discomfort or decreased inability to perform. The goal is not to just train these muscles. The goal is not to sit there and lay on the floor and breathe and don't do anything else. The goal is to optimize the deep core system, coordinate the superficial system, teach the client how to move in a more optimal manner, coordinating the function between these two systems so that they can maintain alignment, so they have regulation. I just had a client call me up yesterday, a friend of mine actually, and she's like, yeah, I've been having this low back pain, and now I'm starting to get some urinary incontinence. So it's another sign your client isn't having good, optimal, deep core control, and or they're overusing their superficial system. So there's lots of systems. Postural issues, chronic tightness, urinary incontinence, chronic injuries like hamstring pulls, groin pulls, diastasis recti, splitting the abdominal wall in your male clients especially, or women that don't have pregnancy or haven't had babies, abdominal hernias, things like that. Those are all signs that your client's core is not working well. And the most common thing we see is an imbalance between the superficial and deep muscles. So, that was a lot. That's a lot of information. It's basically a mini look at how we look at, in the integrative movement system, how we look at the functional anatomy, blend it with the research, and use it in an applicable manner. Because what this sprinter told me, so you're like, so did the sprinter change? So he sent me, I'm like, let me know how your sprinting goes. Because he's like, my next training session was the next day after our sessions. Showed him very simple releases, very simple activation, how to coordinate his breathing with the activations we did. Next day he's like, oh my God, I felt so much better after that information. Now obviously we got to teach him how to coordinate it into his functional movement so he can actually use it. But again, just that one session with him already started to change the control between his deep and superficial myofascial system. So one of the things that really differentiates us from the rest of the industry is we focus on those things that other people ignore or blow off. Or those things that people say, oh, I'm doing that too, I do that breathing thing. Like, are you doing that breathing thing as well as you could or should, or spending enough quality time having your clients breathe, or are you just trying to make things sexy or high level or train somebody like an athlete? Again, here I am working with this 1.1% of 1% of the population. And what are we doing? Same thing we know how to do. Assess, address through our corrective exercises to improve motor control and progress our client so that way they can safely and successfully achieve their health and fitness goals. And that's really how we differentiate ourselves from the rest of the industry, become that specialist and the person that people come and seek out. Because if you just train people hard and you just train people in your sexy way, I mean, obviously people are successful doing that, don't get me wrong. But how are you different than anybody else? Really, seriously, how are you different? Be different because you're extraordinary at the ordinary. Be extraordinary at the ordinary things. Help people better align, better breathe, better control. If you're looking for more information, like this, we got a brand new series of True Anatomy Geeks. Hopefully, I know Adriana, you're part of this community. Jackie, you're part of this community as well. We created this series, Jill and I, my fellow anatomy geek, we created this series sort of as a joke. We were just joking around during when COVID first started, like, hey, let's do something, that people have been asking for, and people really enjoyed it. And now people love this series. It's the best. Sometimes you gotta be bold. It's the best series out there for learning functional anatomy, for applying anatomy, for applying the research and the evidence, and more importantly, for using it appropriately with your clients. So it's not just like, hey, learn this muscle and what it does. It's learn this muscle, here's what it does, here's what the research says about it, here's how to apply it to your assessments and your corrective exercise strategy. So you improve motor control, so you help your clients that have chronic issues. This time we're talking about spinal conditions. We're going to teach you the functional anatomy of the spine, some of the nerve function, what the nerves do, why some of your clients have issues like sciatica. Like Jackie just reached out, hey, do you have any resources on sciatica? I'm like, guess what? We're going to start a brand new one here in a few weeks, coming up in July. We're going to show you the application, how to use this information to assess your client, to use the most appropriate corrective exercises, and also how to use the most appropriate corrective exercises and functional exercises. Because it's not enough just to teach these muscles how to work better. You have to coordinate this deep and superficial muscles so your client can use them in a more optimal way. So that way they can work towards looking better. Because a lot of your clients, even my 85-year-old client Joel, he's like, hey, I want to tone this up. I want to get this thinner. So I'm like, yeah, so it doesn't matter. People at every age, every level, they want to look better. More importantly, they want to feel better. They want to function better because there's things that they want to do or need to do in their everyday life. Like my athlete that needs to or wants to compete at the Olympic level, to be one of the best sprinters in the world, not just in his little neighborhood, but in the world. Again, same strategy applies to those individuals. So I hope you join us. It's really an amazing series. It's an amazing community of like-minded individuals. So we'd love for you to join us. Mary will put the link in next to this video wherever you're watching it, or you can find us at, I'm not sure where you can find us. You can look at, I think we're still at IIHFE. I think True Anatomy Geeks is under IIHFE.com. Until we change our website over. So love to have you part of our community. Love to show you how this information can apply to you and your everyday clients, and if you train higher level athletes, how it applies to them as well. This is Dr. Evan Osar. Thank you again for being part of our community. Thank you for all you do for your clients, and thank you for being a leader that brings people together, that unifies and sheds a light for those individuals that need, want, and are looking for someone just like you. Let's get out there, let's empower our clients, let's attract more individuals that need, want, and will pay for your expertise, and let's make a difference. Make it a great day. We'll talk to you soon.